Clinical depression is one of the oldest recorded disorders, with documentation going as far back as the ancient Greeks. 20% of humans will get it by the age of 35, and women are 2 times as likely to get it as men. Its primary causes are stress and loss, which can be a result of anything from losing your job, troubles with a loved one, loss of mobility or limbs, and even loss of identity. In order to be diagnosed with depression, there needs to be a definite change in how you act. This change needs to last for 2 or more weeks, and your symptoms need to include a depressed mood or adhenia, which is a disinterest or displeasure in things that you used to enjoy. You also need to exhibit at least 5 of the following symptoms: significant weight changes or appetite changes, insomnia or hyperinsomnia, which is sleeping less or more than usual, psychomotor agitation or psychomotor retardation, which is being twitchy or being slow to respond, fatigue, feeling worthless or guilty, difficulty concentrating, and reoccurring thoughts of death or suicide. Once you have been properly diagnosed with clinical depression, there are 2 primary ways of treating it. Now, because depression results in low rates of serotonin, dopamine, and epinephrine in your brain, a primary medical treatment for depression is the use of reuptake inhibiting medications, the most common which of right now is SSRIs, or serotonin selective reuptake inhibitors. These cause more serotonin to be distributed into the brain. The other kind of treatment is a non-medicative treatment called cognitive behavioral therapy, which has 4 phases. The first phase is to increase activities to put you in a better mood. This involves moving, eating better, and even humor, anything to get you out of a negative mood. The second phase is challenging automatic negative thoughts about yourself or the future or the world. The third phase is to identify negative thoughts and biases. And the final phase is changing maladaptive attitudes, such as cutting, sleeping, or even just biting nails when encountering stressful situations. So there you have it. That's clinical depression in a nutshell.